Dressler beat, named after William Dressler from Poland, is a fusion beat interrupting ventricular tachycardia. Fusion beats are recognized by narrower QRS complexes than that of the tachycardia. It is the result of fusion of the ventricular tachycardia beat with a supraventricular beat, which could be originating from the sinus node or any other supraventricular focus. Initial part of the QRS is contributed by conduction through the normal conduction system and preceded by a P wave, though it may not be obvious during a tachycardia. The presence of fusion beats along with capture beats strongly support the diagnosis of VT in a wide QRS tachycardia. Fusion beats can also occur in sinus rhythm. The rhythm strip shows ventricular ectopic trigeminy. The beat marked as VPC is a ventricular ectopic beat because it is not preceded by a P wave, has a wide bizarre QRS complex, secondary ST depression and T wave inversion, followed by a compensatory pause. The next beat, marked as a fusion beat, has a P wave partly hidden by the QRS, marked by red stepped arrow. Width and morphology intermediate between the VPC and the next sinus beat, with preceding P wave and narrow QRS, occurs just before the next expected sinus beat. The ventricular ectopic beat which has fused with the next sinus beat is a late diastolic ectopic, as it has occurred after the P wave of the next cycle. In a fusion beat, ventricular activation is partly contributed by the ectopic beat and partly by the conducted sinus beat. The initial report by William Dressler and Hugo Dressler in 1952 had 6 instances of VT with fusion beats. They noted that this occurs usually when the ventricular tachycardia rate is less than 150 beats per minute. When atrial activity is not visible to demonstrate atrioventricular dissociation during ventricular tachycardia, the presence of fusion beats helps in the diagnosis. Dressler beats have been described in ventricular tachycardia occurring during atrial fibrillation as well. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video.